Well, the new technologies are much like the new Apple iPhone. They're similar technologies in what I do, and everything that comes across my desk that might be new intrigues me, because I go back to the day where we had a patient in the hospital for a week, and now we're doing everything outpatient. Well, I'm a podiatrist here at Beach Orthopaedic Institute, and I take care of the foot, ankle, and lower leg problems. Essentially anything that can go wrong with a foot, an ankle, or lower leg, whether it's an injury, something you were born with, or something shoe-related. Well, I've been doing this for a long time. This, curiously enough, is my 30th reunion for medical school, so it's 30 years of doing this. And I take care of, like I said, foot and ankle problems. And I evolved into that because it's a specialty you can get a hold of. You can actually become somewhat of an expert on a smaller part of the body here. And it started out with a general interest in orthopedics, and it narrowed down to the foot and ankle. Well, the most common injuries are something that we see every day from recreational tennis players or runners. The Palm Beach Gardens community, the Jupiter area, has runners, tennis players, golfers, basketball players, all of which that have these everyday injuries like heel pain or plantar fasciitis, ankle sprains, fractures of the foot, ankle, and leg, far too many Achilles tendon ruptures, problems of the nails, problems of the skin. So those are the everyday things that we treat. I started this in 1979 when I graduated medical school, spent 4 years there in Philadelphia, and got inspired in sports medicine by working with the Philadelphia Eagles there for a while. I was a lowly research assistant taping up football players, but I really enjoyed it. And then moved on to Michigan to do my residency at the Hospital for Special Surgery there in the greater Detroit area, and stayed there about 8 years. Taught a little bit and got more and more experience with the surgical aspect of this as it relates to sports medicine, as it relates to injuries with foot and ankle. Obviously, seeing somebody who's injured at the start and then walks out of the office a few weeks or months later, that's pretty rewarding. It's a joke that I use when they leave. Very often I didn't realize how tall people are when they start because they're on their back or in a wheelchair when we meet. And I'm a short guy and they get up and they're towering over me. So that's pretty rewarding, of course. Probably the most recent thing is a problem that nobody wants to talk about, which is fungal toenails. It's a ugly, thickened toenail that probably affects 50% of the population over age 50. And I see it every day, and there's really no perfect solution for it right now. There are oral medications that help, but have their side effects. But there's a new laser technology that is coming out just this month, as a matter of fact, that women are going to go crazy for, I'm quite certain, and it is a non-invasive technique, office-based technique, no anesthesia required to solve the fungal toenail problem. But there are all sorts of other things as well. There's an artificial ankle joint that's on the horizon now. There's getting more and more data that seems to be working. Years prior, the artificial ankle really wasn't a good procedure. The past year or two, it's really catching on, and the technology there is improving quite a bit.